It feels like every single day we're just wading through this ocean of information, especially when it comes to something as vital as public health, right?
Oh, absolutely. It's overwhelming.
So today we're doing a deep dive into how machine learning is, well, really starting to shake things up in evaluating public health policies.
Yeah. And it's such a critical area. I mean, evaluating these policies properly.
Hmm.
That's how we improve health, use resources wisely, make things fairer. But, the traditional ways of doing this, they're facing huge challenges now with all this big data. A lot of what we'll talk about comes from some really interesting recent research by Li, Zhou, and Ma.
Right. So our mission today basically is to figure out how machine learning offers this like powerful shortcut for understanding these really complex policies, but also maybe uncover some surprising bits and the tricky challenges that come with relying on it so heavily. Okay, so let's unpack this. We've got these traditional methods, right? Difference in differences.
The idea, yeah.
Synthetic control, regression discontinuity. They've been the bedrock for ages. But now, with big data, they tend to be hitting some serious snags.
They really are. And what's fascinating is how they struggle. It's the sheer scale, the complexity. Think about all the unstructured data text from medical records, social media chatter, images even. Plus, you get these data sets with tons of variables, high dimensionality, but maybe not that much actual information density. And this leads straight into problems like model misspecification. The models are just too simple. Or multicollinearity.
Where everything's tangled together.
Exactly. And overfitting, where the model looks great on old data but fails on new stuff. It makes getting an accurate evaluation really, really tough.
Okay, so if the old ways are kind of struggling in these choppy waters of big data, how does machine learning actually help? What's its edge?
Right. Well, ML is really good at handling that messy, unstructured data. Deep learning techniques can process text, images, audio almost seamlessly. And it tackles those model problems more directly. Because it's data-driven, it doesn't rely so much on, let's say, rigid theoretical assumptions. So it's better at capturing complex, nonlinear patterns that traditional models might just completely miss. Plus, you have techniques like dimensionality reduction, PCA is a common one to untangle those variables. And regularization, like Lasso or Ridge, helps stop that overfitting problem we mentioned.
You mentioned practical examples earlier. Where have we actually seen this work? Like in the real world?
Oh, sure. There's a really compelling case study from Brazil. They used ML to evaluate a policy for helping people quit smoking. They analyzed patient data, found the key factors, and then used algorithms, I think it was support vector machines, SVMs,
Okay.
to predict who'd succeed with the treatment. And they got like 72.6% accuracy.
Wow, that's pretty good.
Yeah. And here's the really interesting part. They even built a tool based on it to help allocate resources better, to
Yeah.
figure out where the efforts would pay off most.
That's 72.6%. And optimizing resources, that sounds incredibly powerful, but it also makes me think these models can be kind of black boxes, right? We don't always know why they make a decision.
It's a huge point, yeah.
If we can't interpret it, how much can we really trust it for public health decisions? Is accuracy enough?
That's the million-dollar question, isn't it? These powerful models, their inner workings can be really opaque. And that lack of transparency isn't just a technical issue. It hits trust.
Yeah.
Hits accountability. I mean, imagine trying to explain to a community why a certain health intervention is being rolled out or not based on an algorithm you can't really explain. The why matters a lot.
And I guess it gets even more complicated when you start thinking about the data itself.
Oh, absolutely. Data bias it's a massive concern. If your training data reflects historical inequalities, maybe certain groups are underrepresented because of access issues or socioeconomic factors, well, the ML model can learn those biases. It can end up perpetuating health inequities, maybe by misallocating resources or even making poorer predictions for those already underserved groups. It's a dangerous feedback loop. And of course, you've got all the sensitive health information, so data privacy, ethics. Those are paramount.
Okay, so given these significant challenges, the black box problem, the bias, the privacy, what's the path forward? How do we make sure ML is actually a force for good in public health?
Well, the research points to some key strategies. One big thing is trying to integrate data-driven and theory-driven approaches, basically using what we know about public health principles to guide and interpret the models. Makes them less of a black box. Another is developing better data strategies, using tools like SMOT to synthetically create more data for underrepresented groups to balance things out, or using fairness indicators to actively check if the algorithm is treating different groups fairly.
Right, actively looking for the bias.
Exactly, proactively. And then for privacy, it's a mix. Technical fixes like differential privacy, adding controlled noise to protect individuals, plus strong legal rules like GDPR and just good old-fashioned social oversight.
So it really sounds like machine learning has this incredible potential to revolutionize how we evaluate public health policies, giving us precision we haven't had before.
Okay.
But it's definitely not simple. It comes with these new, complex challenges that need constant attention.
Yeah, it's a powerful tool, no doubt.
Right.
But it demands immense care, immense vigilance. And if you zoom out and look at the bigger picture, it really highlights this pattern, doesn't it?
Yeah.
The most impactful technologies often bring the most profound responsibilities. It leaves you wondering, what other ethical guidelines or maybe even bigger societal shifts do we need to make sure that ML truly benefits everyone's health and doesn't just widen the gaps that already exist?